Got my patient, got the room, the videographer, the floor, ceiling, and then there's me. Hello, Dr. Blake. My name is Talia Drabont. I'm in section KAA, and today I will be performing a head-to-toe assessment. However, before we begin, I just want to disclaim that my partner here, Lydia, does suffer from severe double scoliosis. However, for the purpose of our findings, we will indicate them as normal. Now, before walking to the patient's room, I will be performing hand hygiene. I will be sanitizing the diaphragm and, the diaphragm and the bell of my stethoscope. And I will be donning some fresh gloves on in this moment. Now I'm going to walk into the patient's room. Hello.
Hi.
How are you doing today?
Good.
I'm Nurse Sally. I'm going to be taking care of you today. Can I please just see your identification band? Can I get your first and last name?
Lydia Marr.
And your date of birth?
May 6, 1997.
Perfect. How would you like to be addressed today?
Lydia's fine.
Thank you so much, Lydia. So today we'll be performing a head-to-toe assessment. Is that okay with you?
Yeah, that's fine.
Perfect. And before we begin, do you need to use the bathroom? Do you feel any discomfort?
No, I'm okay. Thank
Perfect.
you.
I'm just going to close the curtain to give you some privacy.
Okay.
So Lydia, can you please tell me your age?
I am 26.
Perfect. So I can see that your physical appearance is congruent with your stated age, and I can also see from your skin color that it is ivory with some golden and pink undertones. So Lydia, I'm just going to get you to stand for me, please. Okay, so upon inspection, I can see that you are symmetrical bilaterally. There are no physical deformities present. You also have a short stature and you are nourished. You can take a seat for me, Lydia. Thank you so much. So Lydia, I can see from your facial expression that you are smiling. Can I ask, what is your mood today?
I'm happy.
So perfect. I can see that your mood and affect are congruent. I can also see that you remained direct eye contact with me. And I can also see from your personal hygiene that you are appropriately dressed for the occasion and there is no signs of bodily odor. Perfect, Lydia. I'm just going to stand up for me again, and we're going to take a few steps forward and a few steps back. Perfect. Take a seat for me, Lydia. Thank you so much. So upon assessing your gait, Lydia, I can see that you have a steady and balanced gait with equal arm swing. Now, looking at your breathing, I can see that you're very much relaxed. You have unlabored breathing, and there are no signs of respiratory distress. So Lydia, can you remind me of your first and last name?
Lydia Marr.
Can you tell me where we are today?
Seneca College.
And what day of the week is it?
Saturday.
Perfect. So I can see that you are alert and oriented times 3 to location, time, and place. Your behavior is very much appropriate for the occasion today, and your speech is very well articulated, very clear, and no signs of slurring. Okay, Lydia, so first we're going to start off with assessing your cranial nerve number 7, which is facial. I'm going to get you to smile for me. Show your teeth. Can I get you to frown? Can I get you to grimace? Can I get you to raise your eyebrows? And I'm just going to get you to close your eyes. I'm going to try to open them. Okay, they are resistant. And can I get you to puff out your cheeks? Perfect. So upon assessment, you were symmetrical, and based on our findings, that we can see that cranial nerve number 7, facial, is intact. So now, Lydia, I'm just going to move into assessing your cranial nerve number 3, oculomotor. I'll be using an assessment called PERLA. So first, I'm going to be looking at the size of your pupil on the left and right sides, and I can see that they are 3 millimeters, and they are equal bilaterally, and they are round in shape. Now, Lydia, I'm just going to be doing a light reflex test, direct light constriction, consensual light constriction, direct light constriction, and consensual light constriction. Perfect, Lydia. Now I'm just going to bring my pen closer to you. Just keep your eyes on it the whole time. Perfect. So I can see that your pupils constricted and converged inwardly. So I can see that based on my findings using PERLA, that your cranial nerve number 3, oculomotor, is intact. So now, Lydia, I will be assessing your cranial nerve number 8, which is acoustic. So can I please get you to close your tragus? I want you to do in and out. I'm going to whisper 3 words into your ear, and you're going to repeat them back to me, okay?
Flower. Purple. Yellow.
Perfect. And now on the other side.
Tower. Magna. Tower.
Thank you so much, Lydia. So based on my findings, I can see that you were able to repeat the words back to me. So this would indicate that your cranial nerve number 8, acoustic, is intact. So now, Lydia, I'm just going to be inspecting your nose. So while upon inspection, I can see that your nose is midline. There is no signs of discharge or crusting. Now, Lydia, I'm just going to assess for patency. Can I get you to close one nostril, breathe in? And on the other side. And I can see that both nostrils are patent. So now, Lydia, I'm just going to be assessing your cranial nerves number 9 and 10, which are glossopharyngeal and vagus. So Lydia, I'm just going to take my tongue depressor here and my pen light. And when I tell you to say ah, I'm just going to take a look. Say ah. Perfect, Lydia. So upon assessment, I saw that your uvula and soft palate had a rise and fall when you said ah. So this would indicate that cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, are intact. So now, Lydia, I'm just going to now begin by inspecting your arms. So while upon inspection, I can see that your arms are equal symmetrically bilaterally. Your skin tone and your skin color is also uniform and equal bilaterally. You've got equal hair distribution bilaterally as well. And I can also see that you have no signs of scars or lesions. Now, Lydia, I'm just going to be palpating. Can you please let me know if you feel any pain or tenderness? Sure. Perfect. Any pain or tenderness? No. Perfect. And there is also no masses and no signs of edema. Now I'm just going to roll down my gloves using the dorsal part of my hands to assess for temperature and diaphoresis, which is excess moisture. Okay, Lydia, so bilaterally, you are warm to touch. There's no signs of diaphoresis. Perfect. So now, Lydia, I'm just going to point at your fingers, and we're going to be doing a capillary refill test, okay? Perfect. So I can see your capillary refill is prompt within less than 2 seconds, which would indicate really good peripheral circulation. Now, Lydia, I'm just going to turn out your palms towards the sky, and I'm going to be assessing your radial pulse. Okay, so the rate of your radial pulse is 64 beats per minute. It is equal bilaterally. It has a regular rhythm and a strength of 2+. Now I'm going to do the same on for your brachial pulse. Okay, the rate is also 64 beats per minute. It is a regular rhythm. It is equal bilaterally and a strength of 2+. Perfectly, can I just please get you to stand for me? And we're going to be doing some range of motion exercises. Okay, starting off, we're going to be doing flexion, extension, ulnar deviation, and radial deviation. Lydia, without any of those exercises, did you feel any pain or tenderness? No. Also no crepitation noticed, and very smooth range of motion. Now, Lydia, we're going to move on to our elbows here. We're going to do flexion, extension, pronation, and supination. Any pain or tenderness, Lydia? No. No crepitation, very smooth range of motion. Now, Lydia, I'm just going to get you to do abduction and adduction. Perfect. And we're going to do external rotation and internal rotation. Lydia, did you feel any pain or tenderness? No. No crepitation noted, and very smooth range of motion. Now, Lydia, I'm just going to